So today's live we got postponed, and we have Dr. Shashidharan joining us live for the show today, and he's from Chennai, and I'm trying to connect him. So can you see me live, Doctor?
Yeah.
Yeah. So we are connecting him. So I've sent the invite. So once you get the invite, please join
Yes.
live.
Yes.
Happens to be the Doctor's Day. It's a National Doctor's Day, and we are trying to connect the doctor now. He happens to be my friend also. He's my school friend, school classmate. So we are going to talk a lot on a life of a doctor, and yeah, finally we
Is it
got
okay?
connected. Doctor, can you hear me?
Yes, I can hear you.
Yeah. Is echo is there? Echo ஏதாவது இருக்கா?
இருக்கு.
இருக்கா?
ஆமா.
ஹெட்ஃபோன்ஸ் எடுங்க.
ஹெட்ஃபோன்ஸ் எடுக்கிறவா?
எடுத்து பாருங்களேன்.
Is it okay?
பாருங்க, ஹெட்ஃபோன்ஸ் எடுத்து பாருங்களேன். எப்படி இருக்கு? எக்கோ இருக்கா?
ஹெட்ஃபோன்ஸ் எடுத்தாச்சு. But still there is an echo. Echo இருக்கு.
Now I think it's okay. Still you have echo?
Yes, yes, there is.
Still is there.
I think you can disconnect the call so that live goes on.
Pardon?
Disconnect the voice call.
1 minute, you please hold on. We are in the phone call. Wait, I didn't disconnect the call. How is it now? How is it now? Is it echoing, doctor?
Now it's not.
Yeah, it will be in English only. Yeah, it's not.
Yeah, it's not.
So finally we got connected, and we are live now. So today happens to be the National Doctors Day. The show was supposed to happen at 5 o'clock with Dr. Shashidhar, but yeah, there was a little bit of echo problem. So we are doing live now. So, Doctor, I just want to ask you. I asked the question some time ago regarding how it is when people treat you like God, and they look up to you for all the things they next to God. That's something that's what they always think when it comes to doctors. So you being in this field of arthrosurgeon, so how do you look, how do you treat the patients, and what do you expect from them also?
A very good evening for joining late. I'm very sorry for that. First of all, I thank all my people, my friends, my patients, and all the people out there. A very good thank you wishes for the Doctors' Day. Jyothi, your question is a little bit a tough question. Let us ask for an easy question. We'll start with the easy question and end up with the
Okay,
tough
easy
question.
question. What question you want?
Uh,
Okay, I'll ask another easy
whatever question,
question.
but
Yeah, I'll ask another easy question, then
okay.
we'll go to this question. But I'm sure going to ask you this. So tell me something like,
Yeah.
why medicine? Why did you take up medicine? Because I never thought you will take up medicine in school. I thought you will end up doing engineering or something like that. Then why this is that from the beginning you are like that or what? Because I don't know. I was a very dumbest girl in the class, so I didn't know much about it.
Okay, so do I. I too a very dumb student initially.
Yeah.
My mother is an inspiration on that.
Okay.
In fact, I remember the day when you remember your memories, no? So from that to those days, my mother used to call me as doctor.
Oh wow.
You will not believe that. Yeah, she used to call me doctor. Whenever I do bad in my exams in my school days, she used to ask me, if you become a doctor and then you keep forgetting such things, how can you write prescription? These questions she used to throw to me when I was doing my sixth standard, seventh standard.
Oh wow. Okay.
So those words, I used to wonder, then how could we do that?
Huh.
If we start writing the prescription and we forget the names of the medicine, then how it will be embarrassed in front of the patient. In my school days, I used to think like that.
Oh.
So whenever I don't perform my class
Mm.
in my school days,
Mm.
my mother was an inspiration. She always say, "Don't worry, when you become a doctor, you'll be all right." Like that.
Oh wow. Okay.
So so till eighth standard, ninth standard, I was not a good student.
Mm-hmm.
But the inspiration and love and affection shown by my mother slowly developed inside me a courage and my attitude towards uh, going through, getting a medicine seat,
Mm-hmm.
helping the common people, serving our own country people, our own
Okay.
countrymen.
Okay.
That was my mother's. Every time you say you become a doctor, you serve the common people. You
Oh.
serve
Okay.
the needy ones.
Okay.
You serve the
Okay.
poor ones.
Okay.
And even she used to tell that you should treat one person free every day.
Oh.
Till day, I used to treat at least one person a day free of cost.
It's really great, doctor. And on this Doctor's Day, I feel so happy that I'm able to say that I was your classmate. Such an inspiring.
Thank you. It all the credit goes to my mother. But
Mhm.
unfortunately, my mother is not here. She passed
Mm.
20 years back.
Yeah, I know. Yeah.
But every day I remember her, and I whenever a credit comes, a patient appreciates my work, a person who really thanks me, those thanks and appreciation goes to my mother.
Yeah, I can understand. Yeah.
Yeah,
So from there, how it
this is the
happened, and
indication.
then you took up mints. Yeah.
Okay. Few words about my school days. I was not a good student initially.
Mm-hmm.
So the information or the experience that I'm going to share right now
Yeah.
will be definitely of help to people who's listening to this live show.
Mm-hmm.
Uh, Before my eighth standard, I was a
Mm.
poor student.
Okay.
My parents, my father and my mother, step by step, they pull me down, pull me up.
Oh, okay.
So my father, one thing was I'm sure was I am very good at science. I was not a good
Okay.
student in math.
Mm.
So my father picked out my faults, and
Okay.
slowly he said, "This is how you should do. This is how you should prepare for that." And
Oh,
everything was a stepping stone.
okay.
And my mother used to always encourage me whenever I fail. So
Okay.
by the time by eighth standard, ninth standard, I came up. Then I know what's my destiny is. So I focused on that, and slowly, step by step, I cleared my math issues,
Mm.
and I slowly cleared my history issues. I had issues in my Tamil language. So step by step, every
Mm.
exam I performed.
Correct. Okay. Okay.
And coming to 11th standard and 12th standard, 12th standard, I know, oh, we are going to become a doctor.
Mm.
So this is how we should prepare,
Mhm.
and let us focus on that.
So he's
So all
saying
the
that
parents out there watching this live,
so what Sashi
don't
there is
pressurize
meaning
your
is
children.
that your parents should focus on you and they should inspire you to what you are. So that's what he means. There are many people joining. Ramesh, Vinod, Geeta, Rajan Chopra, Janardhan, Priyanka, so many people, Nalini, so Pratanu, Monica. So many people are joining us. Thanks for joining. If you have any to ask any questions with the doctor related to his profession or anything related to medicine or anything anything related to doctor field, because we are talking about the life of a doctor. So any questions you can ask him, and he will be able to answer it. And if he's not able to answer it, we'll pull the answer from him. So, doctor,
Okay.
I don't, I'm being very formal to you because it's a show. So tell me, doctor, that what was the turning point in your life? You told about how your parents inspired you to become a doctor and everything. What was a turning point? Was there any turning point? For everybody, there is a turning point. So, what was that turning point in your life?
Exactly. It was my eighth standard. When I completed my eighth standard and I went to ninth standard,
Mm-hmm.
that annual day I fell sick.
Oh, okay, okay.
Okay. That sick point,
Mm-hmm.
that 1 month of initial school days,
Mm-hmm.
I spent in a hospital.
Oh, okay, okay, okay,
During that time,
okay,
my parents, my mother really put some words which
okay,
really gone into my mind.
okay,
Then I realized what is my problem, how to study, go, how to prepare for the exam,
okay,
how to clear your faults. So
oh,
every
okay,
subject, every exam, I'll go and clear it,
oh,
one step at a time.
one step at a time. Okay,
So
fine.
my ninth standard was an inspiration. That was a turning point from a bad student to a good student. So 11th and 12th was really a tough time, but
Mm-hmm.
it was so focused.
Okay.
My parents didn't pressurize me on anything
Mm-hmm.
else. They just inspired me. Being a doctor was my passion because it was right from my beginning, my early days. It was inculcated in me.
Okay.
Getting into medicine, and then once you get into medicine, it is a very tough job. You learning medicine, and you are an young person at that time. You enter from adolescence to youth. So
Oh, yeah.
you in a college day, you will be seeing a lot of people suffering.
Correct, 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 correct. Yeah. So,
So
but
so you there will be a transference. That is, we
okay.
will try to imbibe their experiences, their emotions.
Hmm. Hmm. Got it.
So
But
college
then,
syllabus step by step.
but then it was like only the parents which inspired you, or was it also your teachers, any particular teachers you remember who have always inspired you in school to take up medicine or something like that?
My biology teacher, botany and zoology teacher were excellent teachers.
Who are they? Can I
And
know their names?
one is Rina Jacob. Now
Okay.
she is called the Rina Alfred. She is
Mm-hmm.
the current principal of our school.
Oh, okay, okay, okay. I don't remember. Okay, yeah.
She's a
Okay,
okay. She is our zoology teacher.
okay.
And one other teacher is called Mrs. Vijayalakshmi.
Mm-hmm.
Uh, she is our botany teacher,
Mm.
and her two sons were also doctors.
Yeah, I remember that
In fact,
teacher.
the eldest,
Yeah, I remember that teacher. She used to live near the school only, isn't it? That's
exactly,
yeah.
exactly, yeah.
Mm, yeah.
Her eldest son is my senior
Oh, okay,
in
okay.
college.
In college.
Yeah,
So,
these
which
two people
college
are
did you
really
study,
inspiring.
teacher? Which college did you study, doctor?
I studied in Madras Medical College in the year 95 to 2001.
Okay, 95 to
2001.
2001. Yeah, but then how did you take up being, usually they go for cardiology or this or what specialization. Why did you take up this particular thing of being an ortho?
So in a medical college, every day is a turning point.
Yeah, tell me.
Because every patient is a book,
Okay.
because they teach you emotions, they teach you lessons,
Mm-hmm.
they give you experience, everything.
Mm-hmm.
So in my early days, in my college days, I used to see people with fractures,
Okay, okay,
and most of the people with fractures are normal people. They are not
okay,
sick people.
okay.
They end up in a domestic accident or a road traffic accident, and then they
Mm-hmm.
break their bones.
Okay,
Once you
got it.
treat them,
Okay.
they'll come back to the normal life.
Oh.
So this was a real inspiration for me. So you got to, most of the people who come to a orthopedic surgeon are
Mm-hmm.
normal people. They are not patients.
Okay.
Just before their fracture, they're normal. Unfortunately, they
Mm.
end up in a domestic accident or a road accident. Then they get a fracture, and then they
Mm-hmm.
end up in an orthopedic surgeon. So
Okay.
you treat them in a right way, give them a right
Okay.
guidance. They'll be
Mm-hmm.
absolutely normal.
Okay. So, doctor,
And I
generally, I
also
have a
interested in
question here. I'm stopping you here. You said if is that so that all fractures in the legs, whatever happens, need acute surgery, or is that a particular way that you treat people who have fractures? I'm talking about acute fractures also, like accident
okay.
or you slip and break your leg or whatever happens. Is that everything needs a surgery, or is that only few things need surgery?
Okay. Um, See, if all fractures, for that matter,
Mm.
almost all fractures, not all fractures, almost all fractures has two options.
Mm.
You can either handle it conservatively, that is without surgery,
Okay.
and you can go invasive surgical procedure.
Okay.
There are certain fractures which doesn't need surgery at all.
Okay.
There are certain fractures which needs absolute surgery.
Oh.
So I given you three choices.
Mm.
One is fractures without surgery,
Mm.
one is fractures with surgery, another is the option of doing surgery or conservatively handling.
Okay. Okay. Got it.
All these are patient based, surgeon based, and other factors like the patient's condition,
Mm-hmm.
all those factors, etc. factors where you can opt out a conservative or a surgical management.
So patient based means what? Is he depends upon his mental ability, or what are you saying, or is it
The patient may be critically ill,
okay?
and eventually they'll come up with a broken bone,
Okay. Oh yeah.
where a surgical option itself their life will be at risk.
Okay.
In such situations, we can handle with them with a conservative management.
Oh okay.
For example, prolonged bedridden patient
Okay.
will have a domestic fracture. For example, they
Okay.
can have a fracture of the wrist. On
Okay.
their bed itself, they can injure their wrist,
Okay.
or they can have a fractured ankle. That kind of fractures
Mm-hmm.
can be handled just by giving a conservative management,
Got it. Got
because
it.
they're already bedridden.
Yes, absolutely. I understood. Yeah. Yeah.
So these factors are measured by one term is called quality of life.
Okay.
If you are able to assure them a good quality of life, then we can tighter with their expectations, and then the quality of life that we can assure after the surgical procedure,
Mm-hmm.
then we balance it with the conservative management and the surgical management,
Oh, got it. Got it.
and
Yeah.
we discuss with the people and the family members too, and the decisions can be made along with the family members what to go about.
Got it. So understood that this needs a lot of process and procedures, and depends upon the patient's capacity to handle that. So I have a question from
Yes.
Narmata Srinivas. I had multiple fracture and I was advised for surgery, but one of my life-saving ortho doctor healed it with plaster and physio. Oh, she's giving us information. It's not a question. Okay, we'll take another question. This from Vinod Kumar. He's asking, most complicated and challenging case that doctor has treated. So this was question even I wanted to ask you. What was the case which was really difficult for you to treat and you took long time to think and finally you decided to do one kind of procedure, whatever you wanted to do. So what was the difficult case in your career till now?
Uh, Difficult cases that I operated
Mm.
uh, was initially with my teacher.
Oh,
We operated. My teacher is a very doyen of orthopedics in India.
okay, okay,
So operating, assisting along with him was a real gift for me.
okay,
So we operated a cancer patient, a bone cancer patient.
okay.
Mm, Unfortunately, she was carrying at the time,
Oh God, okay.
and the bone tumor that actually obstructed the birth canal.
Oh, okay, okay.
Even though she could deliver a normal baby, this
Mm.
bone tumor obstructed the way,
Okay.
and eventually a delivery cannot be performed. So she had to undergo a C-section for her.
Oh, okay, okay.
Since she was carrying, we were
Mm.
not able to give her chemotherapy also.
Oh, understood, understood.
So we waited for her to for undergo a cesarean section,
Mm-hmm.
deliver the baby, come back to us
Mm-hmm.
for a bone tumor surgery.
Oh, okay, okay.
She delivered a normal, healthy baby through
Mm-hmm.
C-section,
Mm-hmm.
and then she came back to us.
Okay.
And the hip bone, the pelvic
Mm.
bone, what we call as hip bone.
Mm-hmm. Mm-hmm.
That bone had a tumor inside. It was not external; it was inside growth.
Mm.
So what we did is we completely cut off one half of the hip.
Oh, yeah, okay,
We took
okay.
out the entire bone. We took out the entire bone out
Mm-hmm.
and replaced with an allograft bone, a bone donor of same size.
Oh, okay. Very complicated, yeah.
So very complicated. The bone was arranged from Queensland at that time by her husband. Her husband was a very nice man who mobilized that bone graft from Queensland at that time,
Okay.
and then we measured it was absolutely matching her size, and then we did the surgery.
Mm-hmm.
The surgery took 12.5 hours. We started the surgery at 5 o'clock in the morning
Mm.
and finished the surgery at 5:30 in the evening.
Oh my God. Oh God. It's really, I
Yeah,
think
that was that
it
was a
was
nice
really,
surgery. That was a nice
yeah.
experience given to me by my
I
teacher.
think that would be your lifetime unforgettable surgery, I think, because it took
Yes,
one and a
absolutely.
half hours. It's not a joke. You know, the kind of
Yeah.
stress and the kind of thing you'd have gone through while doing the surgery, I can understand and I can feel it. Yeah.
Yeah.
So, any other thing, doctor, any other experience you want to share, or we'll go to the next question?
Similar kind, another when I became a consultant, an young consultant after my teaching experience and my experience with my teacher,
Mm.
I became an independent consultant.
Mm-hmm.
At the time, I operated on a spine tuberculosis patient.
Okay. Okay.
We that that person,
Mm-hmm.
was he is around early 50s.
Okay.
She had a severe bone tuberculosis of the spinal bone.
Okay.
And if the spine bone is involved, that's a possibility. They can have numbness and weakness, and eventually loss of function of both the limbs, or both upper limbs and lower limbs as well.
Oh,
So
okay,
they can be
okay,
completely crippled.
okay,
That's called paraplegia or quadriplegia.
okay.
So I took a risk of operating on her because
Hmm.
her medical condition was worst.
Mm-hmm.
Post-operatively, we need to give a lot of ICU care for her.
Okay.
Um, so that patient is a friend of mine. Patient's son is a friend of mine.
Oh, okay. So that would
So
be
we
really
started the surgery.
emotional connect also there. Yeah.
Yeah. So I played a role of a doctor as well as a son in
Yeah.
that surgery.
I can understand. Yeah.
Yeah.
So that.
Okay. So both roles I played. Post-operative care also was like that.
Mm-hmm.
Uh, so that surgery we started around 9 o'clock in the night.
Mm-hmm.
You will not imagine. Next day morning 5:30 we completed the surgery.
Oh my God. Really,
It was
hats
one of the most
off to
difficult.
all these doctors. People like you are really inspiring. We think that doctors are it's very easy to be doctor, and yeah, we treat them as God and everything and fine, but couple of times we also think if we become a doctor, we can earn nice money and all that. No, I can really understand. It's not only the money, but also the kind of patience, the kind of perseverance, and the kind of hard work you guys do is really commendable. And on this Doctors Day, I really want to thank and appreciate each one of the doctor during this pandemic time. You are the front runners, and you're helping us everybody to live a safe life today. And it is really emotional even for me to talk like this. But yeah, I can understand that the doctors are really the saviors, and they are doing their work along with, and also being with their family as a great support. Now, coming back to my question, doctor, I wanted to take one
Okay.
of the question from again. There's a question asked: what is the age we need to take a bone density test? This is asked by
Okay.
Narmata
If
Srinivas.
okay if they are a female gender,
Mhm.
they should definitely check their bone density at least twice a year after their menopause.
After the menopause. Okay.
Yeah. In case of a male, if they
Mhm.
are active, I would recommend after 60 they can do the density.
Mhm.
Or if they are not as active as they were, they have a sedentary lifestyle, it is much recommended earlier.
So depending upon your lifestyle, you have to get the test for men. For women, it is recommended after the menopause. Yeah.
Yeah.
So
The
yeah.
estrogen and the progesterone in their body
Mhm.
protects them till their menstrual cycle.
Yeah.
And after the menopause, the hormonal support is withdrawn. So they are vulnerable to osteoporosis.
Got it, doctor. So we'll
So
take
you
another
should do a
question.
density after the menopause.
Yeah. Sangeeta Anand, she has a question. Your best surgeon to tackle degeneration in case we are affected and stay fit and strengthened. This is not a question, this is an information. Yeah, they want to be telling about you. Question Vinod Kumar Ramachandran. Any funny or lighter moments at workplace that doctor wants to share? Any light moments, doctor, which you want to share? Do you have light
Lighter
moments as
moments
such?
every
Do
day.
doctors have light moments? Or they're always like, in the
Definitely.
prescription? Yeah.
No. Those lighter moments are always there. Otherwise, we cannot live a normal life.
Okay. Yeah.
Every day we have lighter moments. We make comments, and we make funny jokes around ourselves, our own colleague. Uh, that's all. Nothing else. Funny moments like normal people only.
So doctors are also humans. We should not forget that. So so fun.
I don't have. I don't think. Sorry. Uh, every day is a normal day, and we do have a lot of funny moments. I don't know. Is there anything specific about it? Maybe I remember. I'll tell you that.
Yeah. So if he remembers anything, then he'll comment later on for that. I hope that is answered, Vinod. We'll pass on to the next questions if there are any. Please do ask questions to the doctor. He'll be answering us. So, doctor, I want to ask you: is there? This is a pandemic time. We are all are panic, and we are all are whichever safe we are, it's still the running in the mind somewhere. So you are going to hospital. You are doing surgeries. You are meeting people. You know, Shashidhar, tell me, how do you keep yourself strong and you handle this? What do you do?
This kind of pandemic is one of a kind in our life experience, right?
Correct,
We have not seen such a kind of a pandemic in our lifetime.
correct.
Um, so the knowledge that we acquired through our textbooks, through our seniors,
Mm-hmm.
and the guidelines from the authorities, we carry over that, and we try to be within that fence.
Okay.
For example, hand hygiene, what we advise the public,
Mm-hmm.
the social distancing,
Mm-hmm.
whatever is precautions that to be taken in a hospital, we do that.
Mm-hmm.
But as doctors are also human beings, so they are also vulnerable for infection. Only barrier that prevents a disease and a doctor is only knowledge.
Correct, correct. Absolutely.
Okay. Otherwise, if I go to hospital, I treat a person, I take all precautions. I wear a mask. I do hand personal protective gear in case of surgery. If I
Mm-hmm.
enter an ICU, I do a personal protective gear.
Mm-hmm.
So coming home, I completely I don't go near my kids.
Mm-hmm.
I go have a nice shower, come out, throw out my old dress, wear a new washed one. So all those precautions I carry over, and good healthy food and good sleep will boost up your immunity.
Correct,
I
doctor.
do that also.
Correct. Dr. Sashidhar, I also want to ask you how mentally you stay stable, because you also hear many things, or you know many things more than us. So how do you keep yourself mentally also stable?
This is a good question, but let me answer it in a very holistic way.
Mm-hmm.
Um, as a person,
Mm-hmm.
I do have a kind of depression. I do have a kind of anxiety.
Mm-hmm.
I do have a kind of frustration.
Mm-hmm.
But at the other end, I'm a doctor, so I am able to understand. Oh, this is a depression. Oh, let us be calm in the time. Oh, this I'm becoming slightly anxious on this issue. So let me be polite and balance.
Correct.
Frustration. Oh, this is a frustration. Let me handle it in a very polite way.
Okay.
But it is just an handling the personality of handling it. It is not a kind of technique which is only done by doctors. So everybody will undergo such kind of depression, anxiety, and frustration too
Mm-hmm.
in this kind of pandemics. Only
Yeah.
thing you won't realize it. Once you realize it,
Mm-hmm.
oh, this is less out of frustration. For example, when you are hungry, you will become frustrated, you will become angry,
Mm.
your temper will go down, and then you will start shouting.
Correct. Correct.
Once your belly is full, you'll become calm.
Correct.
Over a period of time, in your adulthood, you learn this, and
Mm.
you know whenever you are angry, you become frustrated and become your temper goes down, and then you shout at people small, you get irritated for a small issue.
So that's what you
You
do.
understand
You're
this
tuning
idea?
your. Is it that mind game which we are playing? I just want to know. Is it a mind game of you do when you know that it's a panic thing? Then you play a mind game. Yeah, this is like this is just a phase. It will go.
It is
Do
just
you do that?
exactly, exactly. We just reason it. We just reason it. Uh, like example, I told you in hunger. When you are in hunger, you will
Hmm.
become frustrated and your tolerance goes down. No, then oh, you are hunger, so you are aware of it. Then once you are aware it, you eat, take a food, you will be all right. The same kind of anxiety and frustration comes in the pandemic as well.
Hmm.
You got to reason it.
Correct.
Don't emotionally go outburst, show it at your friends, show it to your family members,
Family. Yeah.
show it to your patients. So, and eventually our emotions, our anger will be carried over to them.
To them.
You can
Correct.
cut down at
Absolutely.
yourself itself.
Absolutely.
Yeah.
Absolutely.
It is just reasoning. It is just you reason your anxiety, you'll be all right.
So since
That is
you're a
all
doctor,
reason
you'll
for
be.
some answers.
So since you're a doctor, you know that what you are going through stress or you're going through depression or you're what and then to calm down yourself and everything. So yeah. So
Exactly.
otherwise
Exactly.
also he has given you a lot of way to understand whether what to do in this pandemic time also. Like he has given the example of food, how we have food and how we train our brain that what to do. So next question again, do you see the end of the tunnel, especially with the Indian research team coming up with COVID-19 covaxin medicine, which is currently cleared for human trials? This is from Vinod Kumar.
No, they have not been covered. They are not. They have not been cleared. They are running down. They have cleared for animal trials.
Mhm.
Uh, they are doing a clinical trial on human beings, and that in a very beginning part of the research. It has not cleared the clinical trials at all. It has to be done.
Okay. So it's not yet cleared for the clinical trials, it's on the animal trials only. So we have little more, not little time, there are many months to come actually. Doctor, do you have any idea that when can the vaccine come or when will the medicine come?
Okay, the vaccine, whatever the official information I have,
Hmm.
maybe this year end we may get it
Okay.
from the Indian research side,
Mm-hmm.
and on the international side, maybe next year, mid next year we may get it. We hope it may
Okay.
get a month earlier or so.
Okay. So, but doctor, will we get a medicine? I'm not asking about the vaccine. I do understand vaccines will take time to pass through many other, trials and everything. What about the medicine? Is there a possibility of getting medicine, or it's going to be like that? There'll be many other combinations they'll use on different patients, and different patients have different combinations they use. Is that so? What do you think? Is there is a particular
Okay,
medicine?
this okay. This is a viral disease. Coronavirus is a viral fever.
Correct.
So we do have antiviral drugs for it.
Mm-hmm. Mm-hmm.
You would have seen in the media the Redmisver and Flavipiver, whatever the antiviral drugs that's available. And the drugs that are controlling or able to modify the disease itself. The
Okay.
HCQS drug that you would have seen in the media,
Mm-hmm.
the hydroxychloroquine. That is
Mm-hmm.
a disease modifying drug. And we have already now a store that is the steroidal drugs. That's the dexamethasone and hydrocortisone.
Mm-hmm.
These are the steroid drugs which prevent or subdue the cytokine storm that is experienced in the peak of the viral fever.
Okay.
These, these drugs are already in our store.
Correct. Correct.
We
Mm.
are treating our people with these drugs.
Okay.
What people expect is a magic drug or a drug of choice exclusively for this coronavirus. That is
Yeah,
only under research.
that is only under research, and that will also take some time for us to get it right.
Yeah, yeah, yeah.
Yeah,
But we have antiviral drugs to treat the existing disease.
yeah. But there is always a panic that that particular drug is not yet come, so that's why we have so many lockdowns again. We have so many other problems due to lockdowns and many things, you know. We're not able to live a life like what we were living earlier. So I think that's the reason even people are waiting for that particular one particular medicine as such. I think that's the reason.
Yeah,
Yeah,
yeah, true, true.
yeah. So,
We are expecting
so
same silver bullets from people.
pardon?
We are also expecting the silver bullet from our researchers.
Absolutely, we are also waiting, like from your medical people, from your scientist, from your this thing, some magic to happen. I know it can't happen overnight, but yeah, it will happen soon. So, doctor, coming back to your this thing, you know, how do you start your lifestyle? How is it, you know, what do you, how is it? Is that, you know, do you allocate a time for your family? Do you allocate your time for your friends? Do you allocate? Is there any pattern you follow? How is it? You know, we want to know how is a doctor's life.
The doctor's life, initial part of the career is it is chaos.
Okay, okay,
uh, and second half of the life, and we prioritize what we want to do, and then we allocate. I allocate uh, my time. See, every person. This is for all. This is a secret I can share to my friends and my people. Every person has three lives.
okay,
One is one is the public life. One is the personal life.
okay.
The third one is your private life.
Now this
The
is
public
something
life
new.
is your profession.
No, something new. I mean, I don't understand. What? Come again, please tell me
Okay.
again.
So
Come
you
again.
have a public life,
Ah, okay.
you have your personal life,
Ah, okay.
and you have a private life.
Now, what is the difference between private life and public life? I mean, personal life. It's the same, right?
Okay. No, it's not. It's not same. It's not the same. I can correlate these three lives with the three gunas that we know.
Okay.
The public life matches with your sattva guna, which is a very peaceful, um, calm, balanced life.
Mm.
So your professional life will be always sattva guna. You try to show uh, your good side of your part.
Okay.
You cannot you cannot share your emotion in a professional life, do you?
No, I don't. Yeah. No.
So you always show your good face, your good side of yours in your public life. That is your sattva guna.
Yeah.
Okay.
Mm.
The second is your personal life. Your personal life is your family life.
Absolutely. Yeah.
You share you share all your emotions. You share with your spouse. You share with your kids. You
Parent.
share with your parents. You share with your siblings. You fight with them. You laugh with them. You cry with them.
Mm.
Uh, you the friends too. That's also a personal life. This is called rajoguna.
Mm. Okay.
The third one is called the private life, which you doesn't want to expose even to your wife or even to your spouse. You have a private life,
Okay.
which I can say. This is called tamoguna.
Oh, this is something new
You
I'm
understand?
learning, but you know, I really don't know.
Okay.
The first time I'm learning that
Uh,
Tamoguna. It's called
okay.
Tamoguna.
If you tamas,
Okay, Tamas. Okay.
tamoguna. Yes, we can say that.
Okay.
Okay. If you understand three ways of life that you have in a single day, and you don't mix up with these three lifestyles, your life will be very happy.
Oh, okay. Now I have a question
Example,
here. What is private life and personal life? Personal life and private life is the same life. How can you? What is private life? I'm not really getting this actually. You know, I'm not
uh,
understanding what
see,
is the secrets which we will have, which we will don't share it even with the spouse or even with the
you cannot
closest person
show,
in our lives.
okay, certain phases of yourself you cannot expose even to your mirror image.
Oh, okay,
That can be you can your ego too. That is an animal residing inside you.
okay,
If
okay.
you control it, you become a Buddha.
Oh,
The only thing that we can do is you can tame it.
okay.
If you try to control your ego, it becomes a monster.
Oh, yeah.
If you tame it, it becomes a puppy in your hand.
Oh. Mm-hmm.
So I can say an example:
Mm-hmm.
your professional life and a personal life. You cannot
Mm.
carry your professional life to your personal life.
Absolutely.
If you carry your professional incidents to your personal life,
Mm-hmm.
it'll become a mess. You will spoil your family life. If you
True,
carry
very.
your family life to your professional life, you will mess up with your professional life.
Mm. That's true. Yeah.
So when you try to understand there are three lifestyles in a single day of a single person,
Mm-hmm.
and you know you don't mix up with these three lives,
Mm-hmm.
your life is balanced. The only thing you
Absolutely.
should understand these three lives exist.
We should understand these three
Maybe some
lives
of
and we should
that,
not mix up with the three lives. That's what you're saying, right?
yes, these three gunas should not be mixed up.
But sometimes we end up doing it, no, without knowledge also, I do understand we should not mix up, but yeah, but how to know that we are mixing up sometimes that also we don't realize. Is that so? I feel like
It is
that.
only it is just an experience. You experience it and learn from your mistakes, and slowly you don't mix up.
So, the private life and the personal life should also not be mixed,
Mm.
right?
It should not be mixed.
Okay.
Let us assume a
Mm.
man
Mm.
who is drinking.
Ah, okay.
Okay, he drinks once in a while.
Okay.
It's a private life.
Mm.
He cannot go to a wife and say, "I am drinking, so you allow me to drink."
Okay. Okay. Now I got it. Yeah.
Okay,
Yeah. Understood. Yeah.
you understand? Yeah,
Yeah.
he can go to a party, have a drink, don't get injured himself, come back home safely, or whenever he is able to, not too often, once in a while, you want to try it and then see how it is. But after that, you had a bad experience, you don't do it again. That kind of things can be a private life. He doesn't want to expose it at all. You just forget it.
Got it. Now I understood. Really, I understood. Thanks for this, example because I didn't relate it. Now I really understood, how we should differentiate between personal and private life. Um,
Okay.
Ramesh Subramaniam, perfect, very well, and nicely said. So they're all very happy with your formula. I think you're
Okay.
more like an psychiatrist than a orthopedician, ortho surgeon. I don't know. I'm really shocked, yeah, because so much you're talking about, all this tamogun and everything. It's really,
Okay.
I am like shocked, the kind of gyan you have given us today is like, the other questions, yeah, you'll get this answer, but this is something which is really unique answer, which I really didn't know that there are three types of personalities we have within ourselves, and we should not mix those three things. Um, Any questions,
Yeah.
please do ask. The doctor is with us. So we have answered about this. Any questions I've missed? I'm just scrolling up and checking if I missed any question. Yeah. Okay. So, doctor, we most of the questions are same. I'm not asking. I need a suggestion to tackle. Okay. Is it a question? I need a suggestion to tackle the degeneration of. Okay. So next, I just want to ask another question. What is the thing, as a family people, I mean, your wife or your parents or your this thing, people around you, how have they been supportive to you during your beginning of your career, or now, as you said, you're a little bit settled? And what kind of a support did your family and your close friends gave you?
My wife is the strongest pillar behind me. Initial part of my life, it was really chaotic. I used to start the day by 7 o'clock in the morning and end up the day by 1 o'clock in the midnight.
Oh, okay.
And I
Got
come
it.
back home at 1 o'clock, take my dinner at 1:30, go to sleep at 1:30, 2 o'clock, again get up at 5:30, start my day.
Okay.
Some of the days I start the day by 3:30 a.m. and finish the day by 1 no, midnight.
Oh,
That was
okay.
my initial part of my day. So during that time, my wife was so supportive, and she was able to understand the difficulties I was able to undergo. And she traveled along with me to support me in all difficult situations. Now I understood it is my time to give her, and it is her time that I should give.
Oh, okay.
So I am sharing my everyday time with her. I spend morning at least an hour to talk to her, and then about just it is just a casual talk.
Got it.
So
Yeah.
we used to send the kids to the school. I have at least about 45 minutes to an hour in between from the school timing to my office time.
Okay.
So we used to sit over a coffee. We'll discuss about all the futures, our tour plans, future endeavors, all those things, and it'll be like sweet nothings next day morning. It'll be a new topic
How
till next day
sweet.
morning.
How sweet. Really, very sweet,
Yeah,
doctor. Very nice, very inspiring that, it's also really
yeah.
nice thing that you're saying that you should spend little time with your spouse or the partner of your life
It is
so
very
that.
important. It is very important. And friends play a very important role.
Yeah.
Whenever you have a professional difficulty in handling a patient, emotional setbacks, your close friend really pulls over. The close friend really gives you a hand to come over.
Got
You
it.
have, luckily, I have my own classmates and batchmates who's orthopedic surgeons as well as other department people. Like I have only 2 3 people who are really I can rely upon. And whenever I call for a professional help, that person runs to me and backs me up. The same way, another person is very close to me. Whenever I have an emotional setback, slightly I'm like unconcerned, or I discuss with him, and really talking to him will turn
Relax
up
you,
new
understand
ideas.
you. Yeah. But
So
can I
during
know
this
the name of the
pandemic time, talk
doctor?
to your friends.
Illa, can you tell me who are the school friends you still look upon, or you still talk to them, or you been catching? Because I do understand that there'll be very few people whom you still continue. So is there anybody like that?
Yeah, I have close friends, 4 friends. I almost every day I talk to them. One is Dr. Prabhakar. He is a professional friend of mine, and he happens to be my batchmate, my orthopedic batchmate.
Okay.
So whenever I have difficulty in planning a surgery, in treating a patient, I do share the medical records with him for opinion.
Okay.
And during surgery, he comes to me and supports me during my difficult surgeries.
Okay.
Another is Dr. Saravanan. He happens to be my junior, but he is my close friend.
Okay.
I share all my um, uh, things where he suggests me,
Okay.
and we discuss a lot of issues about lifestyle
Okay.
also.
Okay.
And one is Suresh Satya Sara, that you saw it in the comments.
Yeah, 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 yeah. I saw.
Uh,
Yeah.
Suresh is a police officer, but still he is a very close friend of mine. I almost every day I talk to him. I just
So he studied
keep him posted
in
about
your
what's
school.
happening.
Is it that so in our school?
No, 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 no. Suresh is not our school batch.
Okay.
Suresh was found to be professionally we got connected initially, and later we become very close friends.
Oh, okay, fine. Yeah.
And one more guy is called Sugan. He's a physiotherapist. He
Okay.
is also a very close friend of mine. I used to share all my
Hmm.
professional experiences with him. Whenever he has any issues, he call up on me like an elder brother to share his difficult times, and then I give him whatever experience I have, we share. So almost these 4 people, I talk to them on a regular basis. And this during this pandemic time, talking to them itself relaxes you.
Yeah, that's true. That's true. When you talk to your close friends during this pandemic times or any particular stress times, really helps everybody. I do understand it. So these are the people whom you have always connected and talked about. Tell me some friends who have inspired you, or even in school days also, whom you because I'm going back to school days because we studied in the same school. I've never spoken much to you, or
I
I've never
have
spoken to
I have a
anybody.
list to
So
say. Is it okay? I have a list to do. Can I tell it? Tell it.
yeah, yeah, please tell. No, it'll
uh,
be nice. All our school friends will see the show and they'll be happy that you are taking their names.
okay. So the first one I remember from my sixth standard was Swarnavalli. She
Uh,
is also a doctor. I don't know. I don't have a connect to her now.
okay,
Her handwriting is like a print.
okay.
She used to write nice cursive writing. So I used to like to do like that, but I still till now I am not able to put a good handwriting.
No, no, then doctors don't
Uh,
have good writing, please. Doctors writing
so
only the
Swarnavalli was
medical guy can understand. I mean, the medical pharmacist can understand. Yeah, nobody can understand. Seriously, I've seen 100
those
doctors.
things are years. Those are years. Now we write only in capital letters.
Oh, yeah, I don't know. Because now also I've seen some doctors writing. I really don't understand what medicine they're writing. Yeah. Okay, Swarnavalli then.
Oh, okay. Durai Raj is my math teacher. Durai,
Okay.
he is another group.
Uh-huh.
He really inspired me in math.
Okay.
Rudra Kumar, now he is called Kumar Chokalingam in our group.
Okay.
He is a first rank holder during our early days. So
Okay.
I used to wonder how this fellow plays with us and suddenly gets first rank, and still he plays around, makes mischievous things along with us, and takes
Mhm.
first rank.
Okay.
So Rudra Kumar alias Kumar Chokalingam was an inspiring student to me. Siva Shanmugam is one of is our group mate. He is an inspiring. He is he's a good student, and as well as he's a sports person, and he's always friendly with everybody. Siva Shanmugam.
Okay.
I
Okay.
used to wonder how he's able to handle everybody together, and then still he's able to perform in studies in his daily student life and all.
Okay.
And +1, +2, Suresh Sahayaraj. He is an inspiring student for me on physics, math, chemistry, and all. And Saravanan now residing in Australia. Now he's a resident of Australia. His nickname is called Sang Saravanan.
Okay.
We used to make we used to make music in the lunch hours, dance with for that, and he used to make peculiar sounds like that. So we call him pet name Sang Saravanan. He is an inspiring guy. He is always inspiring. He
Oh,
always
everybody you're saying
go.
inspiring. Tell what inspiring. Sangha means he'll play that.
No, no, no. Saravanan will always come up with new ideas. He says this is how we should solve that, and he will be able to get examples from other students also.
Okay.
Like, so this is what that guy has wrote. So this is how we should approach the exam problem, like that.
Okay.
And Srinivasa Murthy is one guy, is really a big brother in our group. That fellow is really was one turning point in my life. It was Srinivasa Murthy,
Okay.
because
Which
that guy
standard he was?
inspired
Which
me to stay
standard you
in
connected with him?
11th and 12th.
Okay. No, I don't know
That
because
guy
I was in
words.
commerce group. I was thrown in D section. I don't know. Yeah.
Okay, that guy was a guy who prevented me from going abroad.
Oh, nice.
Yeah, because he said, you eat the food that is grown in India. Okay, that food is produced by a farmer that is in India. The vegetable is grown from this India.
Mm-hmm.
That is transported to your house by an Indian,
Mm-hmm.
and you learn all the subjects from the soil of India,
Mm-hmm.
and eventually you become a professional. You got to serve back. You got to give back the society, whatever you got through the society. You understand what I'm trying to tell? I'm a little bit not expressive on that.
I understood, but yeah.
So whatever that we acquired from this soil, we should
You should
give
give
back to
it
the
back to
society.
the soil.
Yeah. So Srinivasa Murthy inspired me on this.
Okay.
So whenever I have a plan to go abroad,
Mm-hmm.
I personally say, like, come back again, serve our fellow men, help them to come out their problems, solve their health issues. So for a period of time, I stopped thinking of going abroad. If at all I go there, I learn a skill, acquire new knowledge, come back to our country, give back to our citizen, our people, our countrymen, my fellow men, my
Very
blood
good.
and kith and kin. So I really followed this guy called Srinivasa Murthy. Maybe he's not in our group, but still I thank him for those words when I was doing my plus two.
Very true. Yeah, he's not in our group. Yeah.
Mm.
So these are the friends you remember and who have inspired you in school days. So there's
Yeah.
one more Balachandran. Ma'am, ask doctor about Bhagavad Gita. He knows very well about that. What do you do? You read Bhagavad Gita and all. Huh?
By God's grace, I have a chance to read it.
Oh, you read in Tamil or you read in Sanskrit or in Hindi? How what language you read?
I read it on a English translation,
Oh, English
uh,
translation.
and
Okay.
those things will definitely uh, keep your mind balanced. So, in this Doctor's Day, let me say, define what is health is. So I can connect that to this. Uh, a definition for health is mental well-being, physical well-being, social well-being, and spiritual well-being.
And
Mental well-being is spiritual well-being.
spiritual well-being. Okay. Huh. Hmm.
You got to be physically, you should be well.
Correct.
Disease, free from disease alone is not health. So mentally you should be very sound,
Mm-hmm.
physically you should be very sound,
Mm-hmm.
socially and economically you will be should be very sound. Not
Mm-hmm.
very sound, at least you should be able to balance it.
Very
And
true.
spiritually you should be able to understand, because
Absolutely.
there are so many there are so many unanswered questions in our life. In our life, we have a lot of questions, lot of uh, wonders happening every day.
Absolutely.
When you are connected to the Almighty can be in any form that you admire, you are inspired to. The Almighty has a lot of forms.
Correct.
The form that you understand, you can take it as your God. There is no
Got it.
name for a God.
Got it.
So when you are sound in these four places, your life
Mm-hmm.
is fine.
Okay.
That is called health.
So that is called health.
That is called health. Mental well-being, physical well-being, economic and social well-being, and spiritual well-being.
Spiritual
You
well-being.
should
All the four should be
yes, you
there
should be
to be to be fit, to be healthy. That's
that
what
is called health.
doctor says. Huh?
Yes, that is
Correct.
called health.
Okay, total health.
Correct.
So these are the four things he is recommending as a doctor. It's not that simply if you're physically well, it's not that. It means everything. Even spiritually also he's added it. Being a doctor, usually doctors don't talk much about spirituality, but we have a doctor who talks about spirituality. There is a spiritual connect we should have. I really agree that we should have, and that will really balance our life. Okay,
Exactly.
nice. So, doctor, before this is the last question I'm asking you for the day. Um, I will take another session with you on Bhagavad Gita because that is going to take a long time, and we will have only for Bhagavad Gita. So we'll do it another day, another
Bhagavad Gita, I'm
session.
not. Okay, okay. I'll try to give a bit of knowledge that I have.
No, it's nice. Today you gave us so much of knowledge. I really didn't know that there is a personal life, private life, and public life. I thought personal life, public life. With the third thing, I really didn't know. It was really nice to know all these things because we also can calculate about ourselves. Yeah. So,
Exactly.
yeah, the final question I want to ask to anybody who wants to become a doctor, what is that he should have in his mind? If he's just studying 10th standard, or he's pursuing, or their kids are studying in 10th standard, what should be the mindset of the parent, also the mindset of the student who want to be a doctor?
The first advice to the student has to feel the passion for the profession.
Okay.
You should have the passion to become a doctor.
Okay.
You understand the real passion in you. If you understand the real passion, not by compulsion, but it's a passion,
Mm-hmm.
then getting a medicine seat will be a cakewalk.
Oh, okay.
Your true love to the profession
Mm-hmm.
will take you the right direction.
Okay.
Clearing your whatever entrance exam, NEET exam, that will be a cakewalk for you.
Yeah.
And second advice is to the parents: understand your kids' passion for the profession. If they
Yeah.
want to become a doctor, help them to become a doctor. If they wanted to become a lawyer, help them to become a lawyer. If they wanted to become a journalist, help them to become a journalist. Don't pressure or push or try to infuse your ideas into it.
Got it.
They are free souls.
Correct.
They have independent life. Let them choose
Absolutely.
their life. As parent, we will guide them.
Very nicely said. Very nicely said. So you should have a passion, and parents should not put their pressure or their wishes on the kids. Let them do whatever they have want. They are free souls, and if they show any passion towards one particular profession, we should inspire them and aspire them. Everybody cannot become a doctors, everybody cannot become actors. Some people can become media people like me also. So, like that.
No,
Okay.
you are a destined. You are destined for your profession. That's how God needs. That's how God works our plan for you.
Thank you. Thank you so much. Doctor, nice to have you, talk to you. And I'm so honored that we studied together. And it's really I feel very happy whenever I talk to a doctor. And thanks for sharing your knowledge. It was really very important things you shared with us. And yes, everybody are still saying that, uh, we need another session with you for Bhagavad Gita. We will surely do a session with you on Bhagavad Gita. Yeah. And
Okay.
thanks for your knowledge, and thank you so much. Have a wonderful day, sir.
Thank
Thank
you.
you. Bye bye.
Welcome, Jyothi. Bye. Bye.